Aspiration is the passage of solid or liquid material through the vocal cords and into the lower airways. Depending on the content and the amount of the material, aspiration into the airways can cause lung damage or even death. One of the most common and damaging types of aspiration is the passage of gastric contents into the airways and lungs. When inducing general anesthesia, clinicians use a number of techniques to prevent the aspiration of stomach contents. Prior to surgery, the patient fasts to minimize food contents that lead to the accumulation of acids. At induction and intubation, clinicians can use cricoid pressure to seal the esophagus against the reflux of stomach contents. They can also suction stomach contents with a nasogastric tube. The most important intervention is the placement of the endotracheal tube with an inflated cuff in the hope of preventing the movement of aspirates into the airways. During emergence, clinicians extubate the trachea when the patient's airway reflexes are recovering. Prior to cuff deflation, clinicians will try to suction as much of the accumulated secretions from the pharynx as possible. They also deflate the cuff at end inspiration, so the first movement of air is outward. Since it's difficult to suction below the cords, clinicians depend on the patient's own cough reflex to clear the rest of the secretions from the airway. Intraoperatively, it has been assumed that conventional endotracheal tube cuffs provide an effective fluid seal to protect against inspiration between intubation and extubation. But is that a safe assumption? A search of the medical literature finds multiple studies that show effective air and fluid seals are achieved at greatly differing cuff pressures. In fact, many studies indicate that cuffs with conventional, high-volume, low-pressure cuffs fail to achieve an effective fluid seal even when intracuff pressures far exceed safe levels. These cuff pressures can be so high that blood flow to surrounding tissue can be cut off, which may result in damage to the trachea.